So we just spun this fat that we got from the patient's stomach, and we put it in the centrifuge, and basically it condenses it and takes all the oil out. So basically I'm just gonna tilt this over and get all the oil out of the fat, because that's not something you want to inject. And I'm gonna replace the plunger and the syringe. And then this will go back into the cheeks. So I'm transferring these larger amounts from this bigger syringe to the 1 cc syringes so that the fat can pass through better with these cannulas. So both of the syringes are different amounts, so we're just going to push these back and forth a little bit, mix them up, and then make them equal amounts so that both sides of the cheeks have equal amount of fat.